Which conditions benefit most from a holistic approach? Now let's talk about the conditions where you absolutely need traditional medical dermatology. What an integrative approach actually looks like in practice. How to find a qualified holistic dermatologist. I'm going to tell you exactly when you should see a holistic dermatologist versus a traditional dermatologist, because there's a lot of confusion right now about what holistic dermatology actually is, who it's for, and whether it's just wellness marketing or legitimate medical care. I'm a board-certified dermatologist who practices integrative and holistic dermatology, which means I use both conventional treatments and evidence-based complementary approaches. And I'm going to give you the framework for deciding which type of care is right for your specific condition. Now you might be thinking, what's the difference? Isn't a dermatologist just a dermatologist? And here's what most people don't realize. Traditional dermatology focuses primarily on treating symptoms with medications, procedures, and topical treatments. Holistic dermatology takes that same medical foundation, but also addresses underlying causes like nutrition, gut health, stress, hormones, and environmental factors. Both are valid, both have their place, but they're not interchangeable, and knowing when to use which approach can save you time, money, and frustration. So here's what we're covering. I'm breaking down what holistic dermatology actually is, the conditions where it works best, the conditions where you absolutely need traditional medical dermatology, and how to find a practitioner who's actually trained versus someone just using holistic as a marketing term. Let's start with definitions. The first thing you need to understand is what holistic dermatology actually means, because the term gets thrown around in ways that are misleading. Holistic dermatology, also called integrative dermatology, is the practice of treating skin conditions by addressing the whole person, not just the skin symptom. That means looking at their diet, gut health, stress, sleep, hormones, environmental exposures, and lifestyle factors that contribute to skin disease, while still using evidence-based medical treatments when appropriate. Here's what holistic dermatology is not. It's not replacing medical treatment with essential oils and crystals. It's not anti-science, and it's not telling you to avoid medications or procedures. A legitimate holistic dermatologist is still a board-certified medical doctor who went to medical school, completed a dermatology residency, and practices evidence-based medicine. The difference is that they also integrate complementary approaches that have research backing them. Things like anti-inflammatory diets for psoriasis, probiotics for eczema or acne, stress reduction for conditions triggered by the nervous system, or targeted supplementation for nutritional deficiencies affecting skin health. The confusion comes from the fact that there are so many people calling themselves holistic estheticians or natural skin practitioners who are not medical doctors and who sometimes give advice that contradicts medical evidence. That's not holistic dermatology. That's unregulated wellness advice. When I talk about holistic dermatology, I'm talking about MD or DO dermatologists who are trained in conventional dermatology and choose to also incorporate integrative approaches. So the framework is this. Holistic dermatology is conventional dermatology plus integrative strategies. It's not instead of, it's in addition to. And the goal is to treat the root cause, not just suppress symptoms. Now let's talk about which conditions benefit most from a holistic approach. The second thing you need to know is that certain conditions are strongly influenced by systemic factors like diet, gut health, hormones, and stress. And those are the conditions where holistic dermatology really shines. The top of that list is chronic inflammatory skin conditions. Let's start with eczema, also called atopic dermatitis. Eczema is driven by immune dysfunction, barrier defects, and often gut dysbiosis. In traditional dermatology, we treat eczema with topical steroids, barrier repair creams, and sometimes immunosuppressants. Those work and they're necessary for a lot of patients. But in holistic dermatology, we also look at food sensitivities, gut microbiome health, and environmental triggers. I've had eczema patients whose flares dramatically improved when we identified that dairy or gluten was actually triggering inflammation, or when we added a probiotic to support their gut-skin axis. That's holistic care, addressing the underlying immune and gut dysfunction while still using topical treatments as needed. The second condition is psoriasis. Psoriasis is an autoimmune condition where skin cells turn over too quickly, creating thick, scaly plaques. Traditional treatment is topical steroids, vitamin D analogs, phototherapy, or systemic medication like biologics. Holistic treatment adds anti-inflammatory nutrition, reducing processed foods, increasing omega-3s, sometimes eliminating triggers like alcohol or nightshades, stress management, and gut health optimization. The research on diet and psoriasis is actually quite strong. There are studies showing that weight loss, Mediterranean diet, and omega-3 supplementation can reduce psoriasis severity. So if you have psoriasis and you've only ever been offered topical steroids, a holistic dermatologist can give you additional tools. The third condition is acne, especially hormonal acne in adult women. Traditional treatment is topical retinoids, benzoyl peroxide, sometimes oral antibiotics, or spironolactone. Holistic treatment looks at hormone balance, blood sugar regulation, dairy consumption, gut health, and stress. I've had patients with cystic acne who cleared significantly when we addressed insulin resistance with diet changes, or when we identified that dairy was spiking their androgens. That doesn't mean you skip the retinoid. It means you use the retinoid and address the hormonal root cause. The fourth is rosacea. Rosacea is driven by vascular reactivity, immune dysfunction, and often gut issues like SIBO, small intestinal bacterial overgrowth. Traditional treatment is topical metronidazole, azelaic acid, or oral antibiotics. Holistic treatment adds gut testing, anti-inflammatory diets, identification of triggers like alcohol or spicy foods, and stress reduction. There's actually good research showing that rosacea patients have higher rates of SIBO, and treating the gut improves the skin. The fifth condition is hair loss. Hair loss can have so many different triggers, but we know for a fact that things like stress and diet and exercise and sleep can contribute to how fast or how quickly your hair sheds over time. And we know that stressful life events and things that trigger our immune response and elevate our cortisol levels can also trigger hair loss. So holistic dermatologists will address all of those factors in addition to nutritional deficiencies and scalp changes themselves to really address the underlying cause of hair loss. So here's the pattern. If your skin condition is chronic, inflammatory, and tied to immune or gut dysfunction, holistic dermatology is worth pursuing. You'll still get medical treatments, but you'll also get tools to address the underlying drivers. Now let's talk about the conditions where you absolutely need traditional medical dermatology. The third thing you need to know is that there are skin conditions where holistic approaches are not enough, and you need conventional medical dermatology as your primary intervention. The number one category is skin cancer. If you have a suspicious mole, a changing lesion, a non-healing sore, or a confirmed skin cancer, basal cell carcinoma, squamous cell carcinoma, melanoma, you need a traditional dermatologist who can diagnose, biopsy, and treat it with surgery, radiation, or systemic therapy. You do not treat skin cancer with diet changes or supplements. You treat it with medical intervention, and the sooner the better. Holistic approaches can be complementary, supporting your immune system, optimizing healing after surgery, but they are not the primary treatment. Skin cancer is medical, full stop. And holistic dermatologists can also address skin cancer, especially if they're board certified dermatologists who also practice conventional dermatology. The second category is severe inflammatory conditions that need aggressive intervention. If you have severe cystic acne that's scarring, or severe psoriasis covering large portions of your body, or a blistering autoimmune condition like pemphigus, you need systemic medications. You might need oral isotretinoin or biologics or immunosuppressants. Diet and lifestyle changes are important, but they're not going to control these conditions fast enough to prevent permanent damage. You can add holistic strategies once the condition is under control or as a complement to your medical treatment, but you lead with medical treatment. The third category is infectious skin diseases. Bacterial infections like cellulitis, fungal infections like severe tinea, viral infections like shingles. These need prescription antimicrobials, antibiotics, antifungals, antivirals. You're not treating a staph infection with probiotics. You're treating it with an antibiotic, and then you can support gut health afterward. And the fourth is cosmetic procedures. If you want Botox, fillers, lasers, chemical peels, and other aesthetic treatments, you need a traditional dermatologist or a cosmetic dermatologist who's trained specifically in those procedures. Holistic dermatology doesn't typically focus on cosmetic interventions. It focuses on medical skin health. There's definitely overlap, but if your goal is aesthetic enhancement, you're looking for a procedural dermatologist, not a solely holistic one. So here's the rule. If your condition is acute, infectious, cancerous, or requires procedures, you need traditional dermatology. If it's chronic inflammatory and tied to systemic health, that's where holistic dermatology adds the most value. Now let's talk about what an integrative approach actually looks like in practice. The fourth thing you need to know is what to expect if you book an appointment with a holistic dermatologist, because the visit structure is different from a traditional derm visit. Traditional dermatology appointments are typically very fast, like 10 to 15 minutes. You show the doctor your skin concern, they diagnose, prescribe, and you're done. Holistic dermatology appointments are longer, usually about 45 to 60 minutes for an initial visit, because we're taking a comprehensive health history. Now, I see a mixture of both of those visits, but here's what I ask in a holistic intake that I wouldn't necessarily ask in a traditional visit. What does your diet look like? Are you eating a lot of processed foods, dairy, sugar? Do you have digestive issues, bloating, constipation, diarrhea? How's your stress level? Are you sleeping well? Do you have a history of antibiotic use at night that might have disrupted your gut? Are you on hormonal birth control? Have you had your thyroid or vitamin levels checked? All of these factors can influence skin health, and if we don't ask, we might miss the root cause. Then we do a physical exam just like traditional dermatology. I look at your skin and I diagnose the condition. But instead of just writing a prescription, I create a treatment plan that includes both medical interventions and integrative strategies. For example, if you come in with eczema, I might prescribe a topical steroid to control the acute flare. But I'll also recommend removing dairy for 4 weeks to see if it's a trigger, adding a specific probiotic strain that's been studied for eczema, using a ceramide-based barrier repair moisturizer, and managing stress with yoga, mindfulness, or therapy if that's a trigger for your flares. The other difference is follow-up. Holistic dermatology often involves more frequent check-ins, especially in the first few months, because we're making diet and lifestyle changes that take time to show results. You might come back in 4 weeks to reassess whether the dietary change helped, and then again at 12 weeks to evaluate overall progress. It's a more collaborative and iterative approach than the traditional model of, here's your prescription, see you in 6 months if it doesn't work. I had a patient recently, a 34-year-old woman, chronic cystic acne on her jawline and chin, and she'd been on oral antibiotics on and off for 2 years. She came to me frustrated because the antibiotics worked temporarily, but the acne always came back when she stopped. We did a holistic workup, ran hormone labs, found elevated androgen levels and insulin resistance. We put her on spironolactone to block androgens, but we also shifted her to a lower glycemic diet, added inositol supplementation to improve insulin sensitivity, and addressed her gut health with probiotics. 3 months later, her acne was 80% clear, and she was able to come off of the spironolactone 6 months after because we'd addressed the root hormonal cause. That's what holistic dermatology does. It doesn't just suppress symptoms, it addresses the underlying problem. So here's what to expect. Longer appointments, a more comprehensive health history, treatment plans that include medical and integrative strategies, and more frequent follow-up. If that sounds appealing, holistic dermatology might be a good fit. Now let's talk about how to find a qualified holistic dermatologist. The fifth and final thing you need to know is how to vet a holistic dermatologist, because not everyone using that term is actually qualified. Here's the credential checklist. First and most important, they need to be a board-certified dermatologist. That means MD or DO, completed dermatology residence, passed board exams. You can verify this on the American Board of Dermatology website. If they're not board certified, they're not a dermatologist. Full stop. Then look for additional training in integrative or functional medicine. Legitimate holistic dermatologists often have certifications from organizations like the Institute of Functional Medicine or the American Board of Integrative Holistic Medicine, or they've done fellowship training in integrative dermatology. That shows they've invested in learning evidence-based complementary approaches, not just calling themselves holistic as a marketing gimmick. Third, read their treatment philosophy on their website or in consultation. A qualified holistic dermatologist dermatologists will say things like, I use both conventional and integrative approaches, or I believe in treating the root causes while managing the symptoms. Red flags are statements like, I don't prescribe medications, or I only use natural treatments, or I can cure autoimmune disease with diet alone. These are signs of someone who's left evidence-based medicine, and that can be dangerous. Fourth, ask what their approach is for your specific condition. If you have eczema and they immediately tell you to eliminate 15 foods and take 10 supplements without doing any testing or using any topical treatments, that's a red flag. A good holistic dermatologist will use medical treatments to stabilize your condition first, then layer in integrative strategies. They won't make you suffer through weeks of dietary elimination while your skin is on fire. And fifth, be wary of practitioners selling their own branded supplements or skincare lines. Not all of them are scams. Some dermatologists do create high quality products, but if they're pushing expensive proprietary supplements as the only solution and not offering pharmaceutical options or over-the-counter options, that's a conflict of interest. I also want to address the cost issue because holistic dermatology is often not covered by insurance. If a practice is spending 60 minutes with you and creating a personalized integrative plan, they're usually operating on a concierge or cash pay model. That can be expensive, so $300 to $600 for initial visit is pretty common. You have to decide if that investment is worth it for your condition. For chronic issues that haven't responded to traditional treatment, it often is. For straightforward issues, it might not be. So here's the vetting framework: board certified dermatologist, additional integrative training, balanced treatment philosophy that includes medications when needed, reasonable approach to your specific concern, and transparency about costs. If they check all of those boxes, they're likely legitimate. And don't forget to get recommendations from friends or colleagues who've also seen similar doctors. So here's what I want you to take away. Holistic dermatology is legitimate when practiced by board-certified dermatologists who integrate evidence-based complementary approaches with conventional treatments. It works best for chronic inflammatory conditions like eczema, psoriasis, hormonal acne, rosacea, and hair loss. Conditions driven by gut health, hormones, and systemic inflammation. Traditional dermatology is essential for skin cancer, severe disease, infections, and cosmetic procedures. And the best practitioners combine both approaches, using medical treatments to control symptoms while addressing root causes with diet, lifestyle, and targeted interventions. Now, I want to hear from you. Have you seen a holistic dermatologist? What was your experience? Or are you trying to decide if it's worth it for your skin condition? Drop it in the comments below. I want to know what you're dealing with. And share this video with a friend if you found it helpful. Thanks for watching.